KVOE AM, KVOE FM, and a good Tuesday morning to Phillip Davis, the CEO of Flint Hills Community Health Center. Phillip, good morning.
Good morning.
Hey, thanks for taking some time to join us this morning. A lot of good things happening at Flint Hills Community Health Center, and today we want to touch on the health center and their expansion of behavioral health services. Phillip, what does that look like?
You know, we've always had a behavioral health consultant. Evelyn Smith has been here, and she's working closely with our medical staff. The goal has been to pull her into appointments as needed. You know, if medical providers suspect an untreated behavioral health issue is causing a physical symptom, or if patient had a condition they needed help managing, like the diabetes or chronic pain or anxiety, they would pull Evelyn into that appointment behavioral health consultant. And that need, as we were seeing, was too great for just the one person. And so we have received a couple of grants, and we had a psychiatrist, Dr. Patel, part-time with us, and we were able to bring him on full-time based on some of this increased funding. And then we've hired 2 additional behavioral health consultants, and then we've also hired a psychiatric nurse practitioner. We've also added some support staff, and so we just continue to add a case manager and a nursing staff to that department.
Yeah.
And so what was 1 behavioral health employee in 2013 has increased to 8 today.
Yeah, expanding the services that Flint Hills Community Health Center provides. Well, as you just said, you have 2 new behavioral health consultants. Tell us a bit more about what they do.
Right. So Blake Morgan and Tracey Davis joined us this spring, and they're both, just like Evelyn, they're licensed specialist clinical social workers. And what we're trying to do here is integrated care, because we want the behavioral health consultants closely tied to our medical care and the medical teams. And so they identify, triage, and manage patients with behavioral health issues. We actually locate them during the working day within the medical care team, so they're accessible and ready, available to the providers for their patients. The consultants joins the conversation, and they support the main goal of helping the patient achieve their overall health and improve their overall health. Sometimes it's just setting health goals or making a plan to meet them and learning how to manage the symptoms. And then they also can and do provide some therapy as well.
Okay.
And then they do refer to psychiatrists or a psychiatric nurse practitioner to discuss how their medications might help. And just specifically about Blake, he has 30 years of experience in mental health. He came to us from the Mental Health Center of East Central Kansas, and he's also worked with nursing home residents. And then Tracey specializes in children and families. She also worked at the Mental Health Center, and she's worked in foster care, domestic violence prevention, family preservation, and some other areas as well. And then they both have ties in Emporia and Eureka.
Well, speaking of Eureka, I understand that increasing the size of the behavioral health staff will be allowing the health center to add behavioral health services in Eureka for the first time. How does that work?
You know, for the first time since we opened there in March of 2014, we're able to offer the same integrated care in Eureka. So we all 3 of the behavioral health consultants go to Eureka one day, and one of them are there each day of the week. And so they are able to work closely with the medical staff there and identify and treat the behavioral health issues.
Great.
And then they also make the appropriate referrals to our psychiatrist or psychiatric nurse practitioner.
And Phillip Davis, CEO of Flint Hills Community Health Center, with us. Finally, Phillip, tell us about the new psychiatric nurse practitioner.
Erin joined us in June. She's worked here in Emporia for 25 years at the health department as a school nurse, teaching nursing at Emporia State, and also at the Mental Health Center of East Central Kansas. Like other nurse practitioners, Erin was a registered nurse who went on to earn a master's degree to become a nurse practitioner. However, instead of studying to become a family nurse practitioner, she chose a psychiatric course of study and became a psychiatric mental health nurse practitioner. She completed all of her clinical training in the psychiatric setting, and so she evaluates patients, prescribes medication if needed, and monitors the effectiveness of those medications.
Good stuff.
She does know behavioral health issues affect all aspects of life, relationships with family, friends, jobs, hobbies, and the overall health. And she is very passionate about helping her patients. You know, we are happy to have Erin, Blake, and Tracey join our staff. and provide quality services to the community.
All right, good stuff going on at Flint Hills Community Health Center. Great information. Phillip, thanks for your time this morning.
Thank you for letting me speak with you, Ron.
All right, have a good day.
All right, you too.